Today we're going to be talking about the regions of the human body, and this information is especially important if you are taking, let's say, an anatomy course. Before we talk about the specific regions of the body, I want to make sure we are directionally oriented. So I want to introduce some basic directional terms. So it's important to know some directional terms that relate to the front of the body or mean front of the body, and then some terms that mean back of the body. So the two terms that mean front, anterior and ventral, I would say anterior is much more commonly used. And then for the back, we have posterior and dorsal, and I would definitely say posterior is the more commonly used term. So anterior is the opposite of posterior, ventral is the opposite of dorsal. Anterior, ventral, front, posterior, and dorsal, back. And in the coming slides, we'll see there are certain regions of the body that are only found anteriorly. We'll see that there are certain regions of the body that are only found posteriorly, and then we'll also see that there are certain regions that are both anterior and posterior regions. One more thing I want to mention is this definition of standard anatomic position. So when we're talking about different regions and when we're using these directional terms, it's important to have, kind of a roadmap of what we're referring to. So standard anatomic position is what this figure is in currently. So if you have a figure, if you have a body that is in standard anatomic position, that figure is going to be standing upright. Their arms and legs are going to be in normal position. So their legs are together, their arms are at their side. And then one thing that you should notice about standard anatomic position, you can see it in this picture, is that the palms of the individual are pointed anteriorly. Okay, so these right here are the figure's palms. So anytime you're looking at a picture and you see palms facing forward, that picture is in standard anatomic position. And the reason why most of the figures you'll see in anatomy textbooks and things like that are in standard anatomic position because this allows us a position of reference. So when we're talking about different regions of the body, we can easily reference their locations, and we can use these directional terms that I introduced to relate regions with other regions. I don't want to introduce too many directional terms in this lecture, but I do want to introduce two more. So we talked about anterior, we talked about posterior. Anterior means front, posterior means back, but there are two more I want to introduce. Those two terms are superior and inferior. Superior means more towards the head or above. Inferior is the opposite. Inferior means more towards the feet or below. So superior above, inferior below. And these are all directional terms, and these directional terms are especially important when you are relating one part of the body to another or one region of a body to another region. Okay, let's start talking about regions. So I want to introduce two specific regions of the head. So remember we talked about superior and inferior. Well, there are these things called planes, and I'm not going to talk about a lot of different planes, but I do want to introduce one plane in this lecture, and it's called a transverse plane. And basically, a plane is an imaginary line that you can imagine, and I drew it in this picture as a dotted line. And basically, planes have the ability to divide the body into different parts. Transverse planes specifically divide the body into superior and inferior parts. So if we're talking about the head, and we have that imaginary transverse plane kind of running, kind of where your eyebrows are out, right above the tops of your ears. If we're talking about the part of the head that is superior to that transverse plane, we're talking about the cranial region of the head. Okay, that's where your cranial bones are located. That's where the bones of your skull are located. But if we're talking about the part of the head that is found inferior to that transverse plane we drew, okay, we call that the facial region. That's where your facial bones are. That's where your nose, where your mouth, where the features of your face are found. Cranial region, the more superior part of your head. Facial region, the more inferior region of your head. A couple smaller regions that I want to mention regarding the head. Okay, there's what's called the buccal region. Okay, the buccal region is where your cheeks are located. Occipital region, okay, that's the back of your head. Oral region, that's the region that surrounds your mouth. And then orbital region, that's the region that's found around your eyes. We just talked about the regions of the head. Now we're going to move down the body a little bit more. So we're moving from a superior aspect of the body to a more inferior aspect of the body. So the next region I want to emphasize is the deltoid region. Okay, this is where your shoulder is located. So deltoid muscle is found in the deltoid region. It's a voluntary skeletal shoulder muscle, allows your shoulder to move around. Your deltoid is found both anteriorly and posteriorly. This next region is a little bit harder to kind of highlight in this specific picture, but this region is called the Axillary Region. It's the region that is basically your armpit region. Okay, so your armpit region is called your Axillary Region. Moving down your arm, the next region I want to talk about is called the Brachial Region. So we can kind of describe this region as being your upper arm. So if we're talking about the anterior aspect of your upper arm, that's probably where your bicep muscle is located. If we're talking about the posterior aspect of your upper arm, that's probably where your tricep muscle is located. Biceps, really strong. Flexors of the arm, specifically of the elbow. Triceps, really strong extensors of the elbow. So brachial region, upper arm. Okay, it's an anterior and posterior region. Some important muscles found in the region. One other thing that's found in this region is the brachial artery, large artery that runs down your arm. So we describe the brachial region as being the region of our upper arm, but if we're talking more about the region of our forearm, we call that the antebrachial region. You have some important muscles there on the front and the back of the antebrachial region. Also in this region, in this forearm region, you have some important bones. So your radius and your ulna bones are found in this forearm region. Your radius is your thumb side forearm bone. Your ulna is your pinky side forearm bone. Next up, we have the carpal region. The carpal region is the region that is basically your wrist region. You have a lot of small hand bones found in this region. They're called your carpal bones. I won't specifically tell you what bones are carpal bones, but you do have quite a few bones in that region, and as a whole, all those bones are referred to as your carpal bones. Finishing the upper extremity off, our last region we'll talk about is the manual region. So when we're talking about our manual region, we're talking about our hands. So the way I remember this is, I think about manual labor. If someone is doing manual labor, they're using their hands. They're utilizing their manual regions. Okay, manual regions means hand. This next region is an important region. It's called the cervical region. So the cervical region refers to the neck part of your body. When you're talking about your spine, I'll just give you a little bit of information about the spine. So the spine obviously runs from the back of your skull all the way down to your tailbone. So the first part of your spine, the neck region of your spine, is called the cervical spine. There are three main parts of the spine: the cervical region, the thoracic region, the lumbar region. If you remember that, cervical spine, C-spine, that is contained within your neck. Next region up is the pectoral region. You have pectoral muscles found in this region. Okay, this is kind of your major chest muscles. Okay, so pectoral region, kind of in your chest region. This is an anterior region. You have pectoral muscles, your anterior chest. So in the previous picture, we talked about the pectoral region, which is the anterior aspect of your chest. Now, if we're talking about your upper back, so this is a posterior region. This is where your shoulder blades are. Okay, so your shoulder blades are also known as your scapula, and we call this region of your body the scapular region. This is where your shoulder blades are. This is a posterior region found on the back of your body. Going back to the front of your body, going back to that anterior aspect of your body, we talked about how you have a pectoral region kind of found between your pecs. You have a really important bone called your sternum. This is the sternum is also referred to as your breastbone. That area that kind of overlies your sternum, we call that the sternal region. Moving down the body a little bit more, I think this one is probably the easiest one. Kind of middle of the body, middle of the front of the body, we call this the abdominal region. This is where your abdomen is found. Abdomen can be divided into 4 quadrants. Maybe you've heard of right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Okay, so just know abdomen, very important region. A lot of organs contained in this region. A lot of times when you're reading about it, it's divided into 4 quadrants. Those quadrants contain special structures that maybe I'll talk about in a future lecture. We talked about the cervical region a few pictures ago. Remember, cervical region is your neck region, the beginning of your spine. I said that you have 3 major regions of your spine. You have your cervical region, you have your thoracic region, and then you have your lumbar region. Your lumbar region is the low back region of your spine. You have 5 vertebrae in your lumbar spine, L1 through L5. Okay, lumbar region refers to the low back. Continuing down the body, inferior to your lumbar region, you have your gluteal region. So this is basically where your butt is at. Your butt is made up of some big muscles, specifically maybe a muscle you've heard of, the gluteus maximus. Gluteus maximus, big butt muscle found in the gluteal region. Inferior to the gluteal region, you have the region that kind of makes up your thigh area. We call that the femoral region. The reason why we call it the femoral region is because you have your femur bones located in this region. You also have some big muscles located in this region. If we're talking about the anterior aspect of our femoral region, that's where our quad muscles are at. If we're talking about the posterior aspect of our femoral region, that's where our hamstring muscles are at. Femoral region is both an anterior and posterior region. You can kind of think about it as your upper leg, kind of where your thigh is at. In the last 2 regions I'm going to touch on are regions that relate to the knee. So if we're talking about the front of the knee versus the back of the knee, there are 2 different regional terms that we use. So the front of the knee, we call that the patellar region. And the reason why we call it the patellar region is because that's where our patella is found. Our patella is our kneecap. Okay, so patellar region, that's referring to our anterior knee, versus when we're talking about our posterior knee, or the back of our knee, we call that the popliteal region. Okay, so front of the knee, patellar region, back of the knee, popliteal. I appreciate everyone tuning in. This is definitely not every single region that exists and that you can label on the human body. But I just wanted to give kind of an overview of some important ones.